Hello, everyone, and welcome to the SavvyCast. This is Jamie, and I am very grateful that you're here, whether you're listening to the podcast or watching on YouTube. And today I have got a very beautiful, knowledgeable about skin and beauty friend and acquaintance from Reveal Beauty, Jacki Despot. Jacki, thank you so much for being on the SavvyCast today.
Thank you for having me.
I met Jacki. She is the patient coordinator yes. At Reveal Beauty.
Patient care coordinator.
Mm-hmm. Patient care coordinator. So if you go to either Dr. Clinton or Dr. Pierce, you will see Jacki and get everything scheduled. She takes wonderful care of everyone. And she is here today to talk to us about some of the skincare options that are non-surgical. And Jacki you've probably seen hundreds of patients, Jacki, who've had yes. these different procedures. So you're very well equipped to share what each one does, what the results can be, and who may be most benefited by these. Also, Jacki, you are open about the fact that you have done these lasers that we're going to be talking mm-hmm. about. I have yes. done one of the lasers, so I can speak to that one. So I think at the end of this, everyone will have a really clear picture of the offerings that y'all have at Reveal Beauty. And I want to preface this by, and you might want to speak to this. I will, from time to time, have friends text and ask me, have you heard of this laser or that laser?
Yes.
Jacki, can you speak to the fact that it's very, very hard to compare because it's almost like shopping for carpet. They name things differently, different companies.
Yes.
It's just not possible usually to compare. Can you
yes.
speak to that?
Yes, sure. Absolutely. So two of the biggest things right now and what we really love to recommend to our patients is the microneedling. That's like a hot topic right now. And there's different types of microneedling. There's microneedling that does not use RF energy. And then there's microneedling that does. And you are going to get a better result when it does use that RF energy. That really heats the skin from within and helps recreate that collagen and also tighten the skin. So that's really important.
May I ask you to elaborate there? I know what that is because that's the one that I've done, the Infinity.
Yes.
It uses needles with RF, and RF means radio frequency. Is that correct?
Yes.
It's heated needles that actually go into the skin.
Yes,
and so you're getting the microneedling, but it's accompanied by heat, which is more effective at stimulating collagen.
Correct.
Than just microneedling. Okay. So
yes.
that
Perfect.
We're talking right now about the Infinity. So
yes,
that is what I have done. I've done 5 of those, and I did that for my neck. Mm-hmm. And I've done my neck and my face, and I've seen a difference. I saw the marked difference, Jacki, personally after the second one. Mm-hmm. And then I've seen gradual improvement since. So mm-hmm. if someone is looking at that, what would you tell them about how many to plan on taking to get results?
Sure. So we do sell the Infinities in a package of 3. And mm-hmm. the reason being is because, like you said, you saw a lot of difference after your second treatment. Mm-hmm. We really want people to get that third treatment because that's when you really see the difference. Mm-hmm. So we want to make sure that they get that third treatment. We have it packaged so that that third one is basically free, just because we really want each patient to get it. Now, it is recommended by the company, but we use Infinity, and it's recommended that you do 1 per decade. So I'm in my 50s, so I would do a series of 5, mm-hmm. and they're spaced 4 to 6 weeks apart. And it, like the second one, I noticed on when I had mine done that I was a little bit more swollen, a little bit more red, and with the third, even more so. Mm-hmm. So you are continuing to damage that skin in the hopes of getting better results, of tightening and producing that collagen.
Well, and I definitely can attest that between the second one where I started noticing the difference, all subsequent infinies after the second one, I just noticed a definite change. Mm-hmm. And y'all will have before and after pictures because I did that before pictures and and pictures along the way.
Yes.
And as far as the tightening, it is absolutely amazing. Is there anything else that it does as far as texture or fine lines, or is it strictly tightening?
It also helps with the fine lines and wrinkles and crepiness. It also helps with some texture changes. If you have any acne scarring or any other type of scarring, it also helps with that. It can also just help the overall appearance of tone, not necessarily as well as some resurfacing lasers, but this definitely helps with just that overall skin rejuvenation and a little bit of a glowness. I think it was what I experienced when I was doing it too.
Yes. Well, I have had such positive results that I do plan to do several more just incrementally because I can tell such a change and I do want to keep it up. And I also do other things. I'm rigorous about daily vitamin C and all of that. But I know people are going to ask because they've asked me, people who've followed me and they've seen me post about it. They're going to ask, in addition to the cost, which, you know, that's something that they can find out, I'm sure, by calling you. They want to know about pain, and I can speak to what I think, and then you can speak to what you think. I do not baby my skin. I never have, because I know that roughing it up is what usually gets the best results. So I do not consider it that painful. I almost just, now I did the Pronox, which is laughing gas, and numbing cream. I find it very tolerable, but then I know there are people who do not think that it's tolerable. So what are your thoughts on that?
Yes. The first time that I did it, and it was several years ago, we have the cocktail surgery where we give a little bit of pain medication and some anti-nausea medication. And that just kind of helps the patient just relax more. And that's what I did at first. We then got the Pronox, which is nitrous. And I was a little scared just to do that without the medication. And I was able to tolerate it really well. There's some areas that are more sensitive than others, like right around here. This is more sensitive. So that's the part that I didn't care for, but it's not too bad. And most people tolerate it with the Pronox, and they choose to do that every time.
Right. So. And doesn't everyone do the numbing cream for an hour?
Yes. Oh, yeah, absolutely. For an hour.
That helps a lot. So, okay. So that's a question. Do you get any more questions about the Infinity before we move on? We've talked about the pain, do it 4 to 6 weeks apart, do one for every decade you've been alive. That's why I did 5. Anything else that people might want to know?
People do ask, if they should, after it's been a year since they completed, should they come back and do them occasionally? And the answer is yes, because we do continue to age, and we do want, you might want to come in and do 1 or 2 a year after you do your initial 5 or however many decades.
Okay. Well, that's definitely my plan. So, okay. Well, Jacki, so we've talked about the microneedling with RF, which is Infinity. So we've covered that. Now, what is the next one that we're going to discuss?
The next one is the CO2 laser. And we use the CO2 RE, we call it the core, and it helps, it's a resurfacing. So it is going to take a layer or 2 off your skin. It treats wrinkles and skin damage or sun damage, scars, a little bit of fine lines and wrinkles around. And it also helps produce that collagen again, because it's damaging your skin, which is going to get down in the dermis and really rejuvenate that collagen. It works wonders on sun damage. It really helps with the brown spots and the uneven pigmentation. So that and the fine lines and wrinkles is what it's known for.
I know several people who have several friends who've done that. And I consider that a pretty dramatic change for one treatment, whereas the Infinity which is a definite improvement, is more incremental. You can't expect to go do 1 or 2 Infinitys and be done. It's more of a process.
Yes.
What I've seen with the cores, it's pretty much a one and done. Is that pretty much accurate?
It is. It's a little bit more invasive. The downtime is longer than an Infinity, whereas the Infinity, that is a 1 to 2 days of maybe a little swelling and redness, whereas the core is more like 5 to 7 days. It is not something that you're going to want to go out and see people. You're not going to even want to go to the grocery store. It's not pretty for 5 days. But after that, it is wonderful. Your skin is extremely soft. It is a new, fresh surface, and it continues to just get better and better up to like 9 months to a year. It's your skin is just rejuvenating, and you have a glow. Not only that, but your skin is just nice and soft and even, and your wrinkles are softened.
Okay. And when Dr. Clinton and Dr. Pierce were on the podcast sharing about different procedures, Dr. Clinton said that if he could tell anyone, I said, what's an add-on that you would recommend while you're getting something else, maybe a surgical procedure? He said he tells everyone that the core is just really almost miraculous in the change you're going to see in your skin.
There is a big difference. I noticed it right away. And you also get and I wanted to bring this up, you get a better result if you're taking good care of your skin before and after. So that medical grade skincare is really important to start using about 2 weeks beforehand, and then obviously afterwards. And we do have several here, and we recommend certain products for that before and then certain products after. So it makes a big difference in your healing and the results that you're going to get. Also, sunscreen.
Oh, absolutely. Oh my
all
goodness.
The time. Yes.
Yeah. Well, I had planned to do that during the summer. And then Dr. Clinton stressed, if you think you're going to be out in the sun, unless you're going to wear a hat, I thought I'm just going to wait, because that is, the sun now is so damaging anyway. So that is good to remember. Now, is it accurate to say that you are totally getting rid of 1 or 2 layers and you're getting brand new skin? I mean, it totally resurfaces.
It does resurface.
Okay.
And it does rejuvenate your new layers. Yes.
Okay. Now, that is only done on the face, correct? Y'all only do it on the face?
We only do it on the face. Yes. The neck is just very sensitive. It's a different, a little bit. Yeah. So we just do it on the face.
Okay. Has he because I know only the doctors administer that. Have they ever done it on hands or décolleté? We
have done some lasers on the décolleté and the hands. Yes.
Okay.
Usually it's a lower powered CO2.
Okay.
And there's different watts of your CO2s. So that is something that we would use a lower power.
Okay, perfect. So if someone is trying to decide between core and Infinity, a lot of my peers right now, they're having weddings, their children are getting married, and they want to look their best, but they don't want surgery. And let's say it's 6 months out from the wedding or 9 months. And they said, Jackie, what's the biggest bang for my buck? What should I do? What would you tell them? And I know everyone's different.
Yes.
So give us a few scenarios.
Okay. So I would say if there's someone who has a lot of sun damage, a lot of unevenness, they are going to want to do the core. They will get a lot of bang for their buck for that, because it also helps with the fine lines and wrinkles and softens some of the deeper ones. It is definitely one of our most favorite lasers that we have. The Infinity is more for someone who's got sagging skin. Maybe their jowls are showing a little bit. They just want to tighten up, or if they have any scarring. That is what the Infinity is for. And a lot of times we pair them. Dr. Clinton and Dr. Pierce will recommend that a patient does the CO2, and then after 4 to 6 weeks, after they're done healing, they do the series of Infinitys. And we can always do, and they have done before, but doctors have done the core and the Infinity neck as one treatment, and then they do their other treatments for their face and neck after that for the infant.
Okay, so you can customize that to each patient or each client.
Yes.
Based on their skin and what they need. Okay.
Correct.
Well, I will say that the reason I did the Infinity is because I went to speak to Dr. Clinton about what I thought was the only option for what I call a turkey neck. It was very pronounced, and I would see it in my cooking videos. And I asked my husband, he says, well, it is a little saggy. So I started thinking about it and obsessing about it. So I went to Dr. Clinton, and he's so honest, and he doesn't try to sell anything. And he said, well, you do have a little bit, and of course surgery could correct that. And then he shared with me the Infinity, and he said, I think you would respond very well. And I did the regimen of the 5, and literally the before and after pictures are amazing, because I've still got 56-year-old skin. It's not super tight, but that obvious turkey neck is not there anymore. So
yes,
if someone has that, that's a definite option.
Absolutely.
There. Yeah. Yes. Okay, so we've talked about those two. Did you also want to discuss IPL?
Yes. So IPL is really good on brown spots. It is something that we have been searching for, a great laser. We finally found the one that we feel like works really well. And Dr. Clinton and Dr. Pierce have sat down with many different lasers, and they feel really good about this one. And sometimes it takes a couple of times to get those stubborn brown spots, but it's something that a lot of people want to correct on their décolleté or on their face, on their hands, whatever area.
Okay, so Jacki, can you define brown spot? Now because when I'm doing cooking videos, I see these. Is that what you mean, brown spots?
Yes.
You don't mean freckles. You mean
correct
age spots.
Yes, age or sun damage. Yes.
Okay, well, I'm going to be doing the IPL because I've done hydroquinone, I've done chemical peels, and these age spots are really. How long? Let's just say someone has 50-year-old hands with considerable age spots. How many treatments typically would it take to get rid of those?
I would say 2 to 4.
Okay.
2 to 4, maybe 5. Yes, depending on how long that age spot has been there.
Yeah. Yes.
Now,
what's the downtime on IPL?
It's going to turn even browner for a couple of days, and then it just kind of fades, and it'll just like fleck off.
Oh, okay. Now, if someone has a lot of freckles, can they still do IPL and it'll just get the brown spots, or will it take freckles away?
That's a great question. I don't know. That is something that I'd have to ask Dr. Clinton and Dr. Pierce, because I don't know on the freckles. I really don't. Okay.
Well, I don't have freckles, but I just thought of that question. Okay.
Yes.
Well, okay. So that about covers the lasers. And I do want you, just before we end, I would love for you to emphasize the importance of medical grade or good quality C, because I've been a believer forever. And if the house were burning down, I would get my people and, my dog, and I would get my vitamin C, because it is so important. I don't go a day without it. I believe in it. So speak to that, about how that needs to be done in conjunction with any of these procedures.
Yes.
For the most effective result.
Right. It is very important. And I think one of the biggest things that most patients see when they use vitamin C is the brightness. Your skin just is a little bit brighter and even. And that is one of the major benefits, but it's also important for the health of your skin.
I know my dermatologist once described it. She said it really, when you put C in, it's almost like you get an instant glow. And that is exactly what I've seen, at least with myself. Your skin just glows and it just gets better over time. So I do believe that doing any of these, you should definitely be having a good skincare regimen. But well, I think this has been so informative. Is there anything else you would like to mention about any of these, or about timing of any of these in conjunction with a big event?
Yes.
Any tips or advice?
I mean, you always want to do it a couple months out. And like you said, if you have a friend who's having a wedding in 6 to 9 months, that's the time to really start considering lasers or microneedling, any of those. You want to give yourself some time to heal and look your best. So don't come in a month before and want to have a laser or Infinity, because you might not get the result that you want in the time that you want. So definitely plan for it.
Yeah, it's a process. So, well, Jacki, thank you so much.
Thank you.
Appreciate it. And I will provide links to Reveal Beauty and anything that we've mentioned. And thank you for your time. And I so appreciate it.
Okay. Well, thank you, Jamie. I appreciate you calling us.
Have a great day.
Okay. Bye-bye.